Hello, this is Sarah, and this is Module 2 of Pharmacology, Part C. At this point, we're going to explore the medications used with Alzheimer's disease. If you can, without looking at the screen, tell me what the two classifications of medications are that are the major classifications of medications used to treat Alzheimer's disease. If you said cholinesterase inhibitors and NMDA receptor antagonists, you are correct. All right, without looking at the screen, can you list 3 cholinesterase inhibitors? 3 prototype drugs for cholinesterase inhibitors. If you said donepezil, rivastigmine, and galantamine, you are absolutely correct. All 3 of these are used in mild to moderate Alzheimer's disease. Donepezil is unique in that it can be used mild all the way to severe Alzheimer's disease. Donepezil and galantamine cause reversible blocking of acetylcholinesterase, and rivastigmine causes irreversible blocking. All 3 of them produce cholinergic side effects. But how do cholinesterase inhibitors work? Well, acetylcholine gets released from the nerve cell and then can go on to talk to the next nerve cell. Well, we have these acetylcholine esterase enzymes in our body that are like little Pac-Men that break down acetylcholine. Cholinesterase inhibitors block those little bad boys. And they allow for more acetylcholine to be available at the synapse to affect the next cell. Again, rivastigmine and galantamine are used in mild to moderate Alzheimer's disease, and donepezil is used in mild all the way up to severe. It's important to remember the adverse effects of cholinesterase inhibitors. Since these are cholinesterase inhibitors, acetylcholinesterase inhibitors, they produce more cholinergic activity. That cholinergic activity is the activity that's over on the parasympathetic side. So the adverse effects usually have to do with that. Adverse effects include nausea, vomiting, dyspepsia, diarrhea, dizziness, bronchoconstriction, and bradycardia. The bradycardia, because of the reduced cardiac output, can cause falls and fall-related injuries. NMDA antagonists. Do you remember which NMDA antagonist you learned about? If you said memantine, you are correct. Memantine, otherwise known as the brand name Namenda. Now, Memantine is used in moderate to severe Alzheimer's disease. All right. So the thought behind the NMDA antagonist is the fact that in the pathology of dementia, we've often got this continuously activated NMDA receptor, which leads to a dysregulation of calcium being allowed in and out of the cell. The difference between the inside of the cell and the outside of the cell, with the amount of calcium that's inside versus outside, it's important for that to be able to fluctuate to allow for neurotransmission to run properly. Okay? So memantine basically blocks calcium entry when there's not very much glutamate present, so that a burst of glutamate will allow for the opening of that gateway and allow for calcium to go in and cause those impulses to occur. Okay? Therapeutically, we want to see the resolution of the Alzheimer's symptoms. And again, memantine is used in moderate to severe Alzheimer's. Adverse effects of memantine are usually minimal. Memantine is usually well tolerated. But the most common side effects include dizziness, headache, confusion, and diarrhea or constipation. And you're saying, how is that? I'm just going to tell you, sometimes meds affect some people in certain ways, and sometimes they affect other people in other ways. So take that one for face value. All right. So let's talk about Aricept, which is the brand name for donepezil. This is metabolized by the hepatic CYP family, Y, and excreted by urine and bile. Memantine is of the other name, Namenda is its brand name, is metabolized hepatically by the CYP450 family and is excreted almost entirely by urine. Administration considerations here. For donepezil, or Aricept, we administer it at bedtime. We can give it with or without food. The 23 milligram tablets must be swallowed whole. So the 23 milligram tablets must be swallowed whole. whereas there are dissolvable ODT tablets, can be dissolved on the tongue followed by water. Memantine, on the other hand, that one also can be administered with or without food. And the ER tablets are extended release. They can be swallowed whole. They can be emptied into a soft food such as applesauce. So we can use applesauce. But we need to absolutely remember this is extended release. Do not crush and do not chew. Okay? There is an oral solution. There is a solution form. And it comes with a specific device. So it's a specific device to administer the oral solution. Do not mix with other solutions for administration. That will tend to break it down faster and wreck its extended release properties. But you got to be watching your clients. If they aren't understanding that this can't be chewed, maybe it's time to use the solution. That's a really good nurse notices those things. Let's just recap some concepts of Alzheimer's disease and Alzheimer's disease treatment. Okay? With Alzheimer's disease, neuritic plaques, neurofibrillary tangles, degeneration of cholinergic neurons in the hippocampus and cerebral cortex lead to memory loss, impaired thinking and reasoning, difficulty in performing ADLs, some psychiatric symptoms. The major risk factor for this is advancing age. We use cholinesterase inhibitors and NMDA antagonists. Please go back and review the medications if you would like a recap of the medications. Have a great day.